Dr. Wolcott, thank you. This has always been a pleasure to have you. You have gone and covered so many important aspects of bladder cancer. And considering this is not your area of expertise, I thank you for doing such a wonderful, comprehensive job of addressing all of these issues. There have been a few questions that have come in, and I appreciate that you brought up earlier about bringing symptoms to the attention of your care team. With some of the newer treatments that are out there, things like immunotherapies and precision medicine, the symptoms may not be from the bladder cancer, but they might be what we refer to as adverse events or sort of side effects. And that's what we traditionally have known them as. And I think it's really important what you had mentioned, bring those to the attention of your providers, because they can do things like adjust your medicines, adjust your treatments, or perhaps switch treatments. And some of them can be, in some ways, they seem really innocuous, not important, but they may be very important, particularly if you have a compromised immune system because of the medications that you're taking. So thank you for bringing that up. We did have a couple of questions. One came from an individual. Transgendered individuals face specific challenges, barriers, and traumas relating to getting diagnosed and accessing excellent, respectful treatment of the disease. What resources are there for patients? What resources are there for their treatment teams to help them maybe better understand the needs of transgender patients? Do you have any suggestions? We didn't even cover that in this talk.
I wish I had great wisdom about that, to tell you the truth. There certainly are large healthcare systems who, and I would say some of the larger, like NCI designated comprehensive cancer centers, that are becoming more sensitive to the needs of the LGBTQ plus community. I cannot say that I know right offhand of any organization that has a very high level of commitment and expertise to providing kind of specialized care. I wish I had a better, it's a very important challenge. As you know, there's I think a horrific social context where this community is often being misunderstood and in general in our society. So I wish I had great wisdom other than to say, if you know someone who is in that group who wants to get best care, I would really see, depending on what part of the country you're in, I would try to locate the National Cancer Institute Comprehensive Cancer Center in that area. For instance, in Los Angeles, we have City of Hope, and we have UCLA, and we have a number in this area. There's UCSF, others. Probably an NCI designated comprehensive cancer center would be the most likely resource of having both the commitment and the expertise to provide optimized and individualized care for members of that population. But I don't know, Stephanie, if you have any other comments.
Well, I think what you mentioned earlier, sometimes some of the larger academic hospitals have a little more comprehensive programming because they have specific programs and services for transgendered individuals. So sometimes they may have better connections to have somebody with expertise on the care team. That's my only suggestion. There are always going to be some excellent providers in the community setting, but they tend to be, I think, a little more available in the larger academic hospitals, just because they see many more patients.
Yeah.
So that seems to be what I find.
Yeah.
So, okay. Here's a good question. How do you suggest we handle intermittent scanxiety that accompanies cystoscopies and CTs? If you haven't felt like you needed to take any medication regularly, but the anxiety peaks, is there something you can suggest people can do to sort of self-calm themselves?
Okay. Well, first of all, I would say it is important to learn Relaxation techniques that work for that individual. Okay, sometimes it's structured kind of deep breathing. Some cases it's guided imagery. There are a variety of kind of self-administered relaxation techniques that one can learn and utilize that can be helpful. Often there are specific, what we call desensitization, one term, approaches when somebody has procedure-related anxiety. And I've seen patients, and these are often sometimes social workers, for instance, or psychologists, often say a small number of sessions can be useful in kind of progressively exposing in imagination the person to that stress-inducing experience, like having a scan, where the high level of initial anxiety response is diminished through this experience, so that when they actually have it, that it's much less stressful. And I've seen patients who couldn't tolerate it at all, then go through procedures with absolutely no distress or anxiety. So there are specific techniques if kind of the self-help relaxation techniques don't work. There are situations clearly where medications like Ativan, and many patients who have bladder cancer would have been exposed to Ativan or lorazepam for a variety of reasons, that often very low doses of Ativan can be used and also very helpful. So there's self-management, there's specific, what we call desensitization interventions that could be given by someone with appropriate expertise, like a social worker or perhaps psychologist. And occasionally medications, very low doses of Ativan may help reduce, and there are other medications, but Ativan is the one that's commonly used in this setting. And I would say between the three, you should be able to kind of get through the acute anxiety of the procedure itself. Now, having normal anxiety about what is it going to show and what is it going to mean for me in terms of, is there evidence of a tumor spreading or recurring or whatever, that's more complex than simply managing the anxiety of the procedure itself. And that requires a somewhat more complex approach from my standpoint. But getting through the procedure, those three approaches should work.
Thank you. That's very helpful. So if you don't have an affiliation with a larger hospital that might have an oncology counseling specialist, is there any way you can find somebody? What are you looking for when you're looking on a Google search for somebody in your community if you are not near a large hospital that has oncology counseling services?
Okay, well, I don't know the extent to which BCAN sees this as a service you're capable of providing, but I will, and you do lots of things, but I don't know you do that. There are a couple of other organizations that are really important potential resources at a national level of having knowledge about resources. One of them is Cancer Care that BCAN has a relationship with, which is historically primarily based in the New York, New Jersey area. Has a very distinguished career in providing services. Another organization that I'm myself quite actively involved with is called the Cancer Support Community. Mm-hmm. And the Cancer Support Community has a wide variety of affiliates or service locations throughout the United States. It has a central headquarters in Washington, D.C. It has an extended hours helpline and can be accessed. And it has quite a significant database of information about service providers of various kinds over and above what Cancer Support Community itself does. Mm-hmm. So I would, that's a resource that I think is worth knowing about. I will tell you that there are not nearly enough psychologists and or psychiatrists in our country to meet the actual need of those cancer patients who require that level of sophisticated care. in my professional organization that I'm involved with, the American Psychosocial Oncology Society, which is multidisciplinary. We have social work and psychology and psychiatrists. It's a wonderful organization. But I haven't checked recently, but last time I checked, we had about 50 psychiatrists who work with cancer who are part of that organization. Most of them faculty members at major NCI designated comprehensive cancer centers. So once you get outside of that environment into the community care environment, I live in the Thousand Oaks area, which is northwest of LA. And we've had historically a couple psychologists and psychiatrists who really have focused on caring for patients with cancer and have some expertise. But it is really hard. But if you can't find any place else, I would start with the Cancer Support Community's headquarters national helpline, and they should be able to help.
Yeah, great. I know Patricia and I just put the number of our call center that we do with cancer care, and they have an extensive database which does help identify some of the resources that might be available in the community, and partly why we partner with them, because they do have all of these phenomenal resources at their fingertips, which is excellent. So thank you so much.
Should I stop sharing my slide?
You can stop sharing your slide and your image will be bigger. That's fine. Perfect. Okay. So we only have a couple more questions. Let's see. Any suggestions you have for people who've already had their bladders removed and have a change in lifestyle due to an ostomy? Do you have any suggestions on just sort of in general fitting in and feeling better about themselves? There was also a thank you for a very thorough overview, which you've done so far.
I think my major suggestion would be, if you're in, say, a partnered relationship of some kind, this is a problem for you and your partner, or it's not simply an individual problem. From what I can tell, probably the best help for such individuals is to be in some kind of support group or other environment where you can communicate with other individuals who have had either the same procedure or very similar procedure, and kind of listen to each other, educate each other, care for each other, support each other. To my mind, that's the most powerful resource that you can find over and above whatever a partner may be able to provide in terms of supporting you.
And BCAN does list the ones that we know, the support groups that are happening around the country. Some of them are virtual, some of them are in person. So if you visit BCAN.org, you'll look under the support tab and you will find the listing of the support groups that we know about. And also, if you find a support group, especially if there's one that's unique to bladder cancer, please let us know about it so that we can be sure that we add it to our resource. Because if you're looking for something, odds are pretty good that there's somebody else looking for the same thing. So there is one more question that I don't think we're going to actually answer, but I would love to see, this is something that we as an organization can really look into. And the comment was, unfortunately, at present, most urological practices, even those aligned with major cancer centers, do not have a staff social worker on hand and offer no supportive services to their patients. The rationale is that most bladder cancers begin as stage 1 and logically are treated only at these practices. It's so different from breast cancer practices where supportive care is given regardless of the stage. What should we as an organization be doing to change that? What is your suggestion?
I would create, either on your own or perhaps in collaboration with other organizations that would have a similar goal, some system for evaluating each provider, whether it's a community provider or a quotes clinic or whatever. What are the level of supportive care services that they provide? And have some system for appropriately measuring that and analyzing that and reporting that in something like A to F system or some other way of telling people. This is one of the historic, in my view, unforgivable limitations in our cancer care system is we're willing to spend appropriately an enormous amount of money on diagnosis and treatment and very expensive interventions. And we spend almost nothing on supporting the patient as a person, as opposed to treating the cancer. I'll just tell something from my own experience. I worked for a company that was really committed to whole person care. And we managed, during the time I was with the company, 20 hospital cancer centers around the United States, Cedars-Sinai in LA being one, and many others. And my job was developing these supportive care services where we had everything: social work and dietitians and psychology and psychiatry and pain and symptom management and spiritual care and rehabilitation. Our costs of doing it averaged 1.5% to 2% of our operating revenues for each cancer center. To actually do it right is not very costly, and it provides enormous benefit, not only to patients and family members, but to care providers, because we can provide a level of care and we can take difficult, complex patients out of their daily schedule and so forth. So I really think the one thing I'd say is there needs to be a system by a credible organization that says, this is a way of knowing and understanding what level of services in the supportive care arena that each provider is providing. And I'll just make one other, since I'm on a soapbox at the moment. The American College of Surgeons Commission on Cancer and other organizations have major care standards, many of them in the area of supportive care services, okay? But they say you either have to provide the service or refer. Essentially, every provider says either we provide the service or we refer. What I would say is, if I was king, how many of your patients with, say, bladder cancer actually saw a social worker in the last year? Not do you have the service, but how many patients actually saw and how many services did you provide? Because that would make it concrete and real. So that's one thing I would do for your organization with others, is say, let's have a way of evaluating this and communicating this to the bladder cancer community.
Well, thank you for that suggestion. We will definitely look into it. We are looking at excellence across the country in some of the large academic centers and how patients are being treated in their community settings as well, and trying to really come up with standards of excellence so that we hope the rising tide will lift all boats, and anybody with bladder cancer will see a provider that offers a full range of care through their diagnosis and beyond into survivorship.
And it's true now with virtual care capabilities, which are not ideal, but they're better than nothing. There's really no reason why a relatively small number of professionals couldn't be accessible to a significant number of providers and the patients that they treat.
Yeah. Well, thank you so much, Dr. Wolcott. As always, you are just amazing, and this has been a phenomenal, comprehensive program.